So somatic related touch can be a standalone. Um, However, if you are seeing a psychotherapist who is trained in somatic experiencing related touch, um, generally speaking, it's going to be part of the therapeutic process. So there's going to be a talk element off of the table, and then there's probably going to be this touch element on the table. Now, for some clients, the idea of being on the table just doesn't feel right, or perhaps there's a contraindication for that. For example, if the client is coming to me around sexual addiction, for example, I'm going to be very, very careful as I consider whether the use of the table and touch, for that matter, is going to be helpful or not helpful, to be triggering for the client. So the therapist is always going to be considering, is touch helpful for this particular client? Does it lend itself to the treatment plan? And only then is touch used. But again, if the client is not comfortable with the table, we can start on the couch, for example. I have clients with whom I might start even just touching their foot with my foot. Or I might, sit beside the client on the couch and have them experiment with what this is like, what touch is like. I might invite them, for example, to lean into my body and just notice what that's like. There's no have-tos. This is all about the client giving permission for whatever the next step might be. I will bring it up, would it be okay if we did this? And I always encourage clients to be really, really honest with me or whoever the therapist is, so that we know, so that there's, fully informed consent, because otherwise we run the risk of reenacting when choice was not respected for the client. So again, the touch can be here on the table, or it could be like on the couch. I might hold, for example, the client's brainstem, which is a very, very regulating place to hold. If the client is on the table, I might do the same thing by just holding underneath the head, kind of holding that occipital ridge and right above and below that. Just sort of sensing into the client's brainstem, for example. There's different places on the body that I would touch depending on what the situation is. And again, I might titrate into, being here on the table. And even on the table, I might titrate it. I might just start with one place and then maybe go to another place as the client feels comfortable, as their system is coming more into regulation. And they have more capacity to be with whatever's coming up for them as a result of the touch.